and gentlemen, on behalf of the Academy of Medical Laboratory Sciences and STEM exhibitions, I'd like to welcome everyone to Biomedica 2012. I'd now like to introduce the President of the AMLS, Ms. Maire Culliton.
Thank you very much, Mark. Distinguished guests, exhibitors, fellow medical scientists, I bid you welcome to Biomedica 2012. It gives me great pleasure to be here again at this magnificent exhibition and conference, which pays a tribute to all that is excellent in laboratory medicine in this country. For our exhibitors, I am delighted to see you here again in such numbers, demonstrating your continued enthusiasm for our exhibition and conference. For you, this is a major showcase, where you can display all the current state-of-the-art technologies that we need to provide an effective clinical laboratory service. In addition, you are providing us with innovative technologies which are on display here, allowing us to see what possibilities are for our future. I want to pay special tribute to Mark Neville, Bob Kite and their teams for ensuring that this conference and exhibition are presented to you here today. It is the synergy between scientists and the IVD sector who bring quality products to market, and the scientists in clinical laboratories who validate the performance, which leads to the quality service that is laboratory medicine in Ireland today. When I spoke here 2 years ago, I addressed the issue of change and preparation for the future. In the intervening years, much has changed. The laboratory service has become a leaner place where we do a lot more with a lot less. There has been a concentration on the number of results produced per staff member. We now have metrics which allow for comparison of output. There has been a systematic review of the workload in all hospitals with a view to reconfiguration of services. There has been engagement with the scientists and pathologists who provide this service, and through the foresight and hard work of those representing us in preparing the blueprint for the future, there has been some recognition of the complexities involved and the need to control the service within the public domain. The HSE has now endorsed the next steps to establish the National Pathology Network and to appoint a director to oversee its implementation. As a profession, medical scientists have delivered on the requested reforms. We have changed our working patterns and now provide a service where the need has been identified on a routine basis from 8 until 8. This has been done with no increasing in staff and an expected saving to the system of close to €10 million. While the HSE does acknowledge the quick time frame within which these revised arrangements were implemented, it is unfortunate that the media in general have not seen fit to recognise this major contribution from such a small number of professionals. We have also once again led the way for implementation of change. Where we have gone, others now must follow. For the implementation of pathology networks, an integrated laboratory information system is vital. Progress in this area has been slow, and the expected savings and efficiency of the pathology network cannot be realised without an integrated laboratory information system and a unique patient identifier. But the reconfiguration of laboratory services must not be done in isolation. Implementing significant change in laboratories without consideration of the wider dimension of hospital and primary care services is putting the cart before the horse. The laboratory service provided in every setting must be appropriate for the clinical need. The new National Children's Hospital must have a laboratory that is appropriate for its needs. The co-location of specialist services such as metabolic screening and molecular genetic testing within the Division of Laboratory Medicine in this campus is vital. The integrated platforms that handle large volumes of analysis in general hospitals are not capable of dealing with the microsamples that come from our smallest laboratories with the expertise for analysis and interpretation of results from premature neonates to puberty are required. Playgrounds in children's hospital are important. Laboratories dedicated to the diagnosis of children's diseases are important to ensure that they get to play in these playgrounds. The proposed transfer of management within the community of an increasing number of chronic conditions requires that the appropriate provision of laboratory investigations in primary centres be reviewed. The provision of point-of-care testing within the community must be under the control and governance of the professionals who understand all three phases of the process: the pre-analytical, analytical and post-analytical. This is best achieved through integration of these services with pathology networks. We will hear today about the need to register scientists in laboratories to protect the public. Patient safety is paramount. It does not make any sense at all to cede provision of point-of-care testing to other groups who do not understand the limitations of the tests, nor have accreditation of the services, nor responsibility of the consequences of the results of their examinations. The HSE Director for Patient and Quality and Safety, Dr. Philip Crowley, wants to see a health service with a healthy, strong, questioning environment. In laboratory medicine, we do this all the time. Our quality systems have questioning of our service at its core. We validate our methods and our systems, and we audit our practice against very rigorous standards. But we need to question more. We need to ask, are we doing the right tests on the right patients in the right setting? We need to put a stop to waste and to unnecessary investigations that do not add value to decision making. Instead of asking, can these tests be done cheaper and faster, we should say, why are they being done? When we see decisions being made that are detrimental to the quality of our service and to patient safety, we must question. The decision to encourage so many of our scientists to leave the profession prematurely was not wise. To remove over 70 scientists, or 5% of the total workforce, overnight, with little provision for replacement, was not smart. The service has continued, but the long-term effects of such a decision will not be seen for several years. The cohort who left the service was, by definition, the most experienced. And without adequate succession planning and transfer of organisational memory and learning, the development of the service will be stalled. In conclusion, I urge all those involved in healthcare to look to the value added by laboratory medicine. Through judicious use of our skills and analysis, costs can be saved elsewhere within the health service. By tapping into our knowledge of quality management, patients can be assured of quality outcomes. By increased integration of laboratory medicine into primary care, more patients can be managed within the community. Medical scientists are not faceless people in the laboratory. We are partners in diagnosis and monitoring of disease. Thank you.